The mental health program is one of the essential public health programs that address a growing need among Filipinos today. Mental health is crucial and is a crucial component of overall well being. It influences how we think, feel, and act in our daily lives. It also affects how we cope with stress, relate to others, and make decisions. When mental health is compromised, it affects not only individuals but also their families, their workplaces, and their entire community. The DOH National Mental Health Program aims to make mental health services available, accessible, and affordable across all levels of the health system, from barangay to tertiary hospitals. And we nurses play a vital role in this program. Being at the forefront of this program, we are doing early detection, intervention, and health promotion. As community health nurses, we serve as mental health advocates, educating families, recognizing early signs of distress, and providing appropriate referrals. The mental health program is anchored on Republic Act 11036, the Philippine Mental Health Act of 2018. This law establishes the right of every Filipino to mental health care and protection from discrimination. That means mental health is not a privilege, it is a human right. People should never be treated unfairly because of their mental condition. This law also mandates the integration of mental health services into general health care, especially at the primary and community level. This ensures that every RHU, every health center, or every public hospital provides basic mental health support, not just in psychiatric hospitals. RA 11036 promotes mental health education in schools, workplaces, and public institutions. This is to reduce stigma and raise awareness. As nurses, our role in community education will be key to achieving this mandate. The vision of the mental health program is to build mentally healthy communities where every Filipino enjoys psychosocial well being. This means communities where people are emotionally resilient, socially connected, and able to access support when needed. The program's goals include ensuring accessible, affordable, and culturally appropriate mental health care. Care must respect local culture, values, and traditions, like, for example, involving families and faith leaders in counseling is often more acceptable in the Philippine context. Another goal of this program is to strengthen coordination among sectors, like the health, education, labor, and social services sectors, because mental health is not just a medical issue. It is a social and economic concern as well. This multi-sectoral coordination ensures that every Filipino receives the support they need wherever they are. The mental health program is guided by these major principles. First, mental health is integral to general health and human development. We cannot separate the mind from the body. Emotional distress can worsen physical illness and vice versa. Prevention, early intervention, and recovery oriented care are the priorities. We want to identify problems early before they become severe, and we emphasize recovery and reintegration, not lifelong institutionalization. Then programs, especially mental health program, must uphold dignity, rights, and social inclusion. People with mental health conditions deserve respect, possible employment, education, and full participation in society. Nurses should model this by using non stigmatizing language and compassionate care. The key priority areas of the mental health program is the promotion of mental health and prevention of mental illness. This involves awareness campaigns, school based wellness activities, and family education. Another one is integration of services at all levels of care. This ensures that primary, secondary, and tertiary facilities work together to provide a continuum of care, from counseling and crisis intervention to hospitalization when necessary. These also include human resource development and intersectoral collaboration. This means training health workers, teachers, and barangay officials in basic mental health care and strengthening partnerships among stakeholders and institutions. Mental health promotion focuses on creating supportive environments where people can thrive mentally and emotionally. It encourages positive mental well being through education and community programs, like, for example, stress management workshops, parenting classes, and youth empowerment seminars. It also promotes resilience and life skills training, helping individuals develop coping mechanisms for everyday challenges. These initiatives target schools, workplaces, and vulnerable groups, such as adolescents, the elderly, and survivors of disasters, through campaigns like Mental Health PH and Lusog Isip. Nurses usually spearhead or participate in these activities to help normalize conversations about mental health. For mental health conditions and concerns, prevention and early intervention is important. These focuses on reducing risk factors such as stress, violence, substance abuse, and neglect, all of which can trigger mental distress or disorders. It also involves screening and assessment at health centers and barangays. PHNs and BHWs use basic assessment tools and observation to detect early signs of depression, anxiety, or behavioral changes. Once early warning signs are identified, nurses provide psychosocial first aid or referral to a mental health professional or facility. Our timely action can prevent crisis, hospitalizations, or even suicide. Treatment is not just about hospital based psychiatric care, it is now community centered. The program ensures accessible mental health care in hospitals and community facilities, including counseling and support groups. Treatment options include psychotherapy, medication management, and rehabilitation programs designed to restore functionality and reintegrate individuals into society. Community based treatment is preferred because it reduces institutionalization and promotes dignity and recovery. Patients heal better when surrounded by supportive families and communities. Community based care is the cornerstone of the Philippine mental health approach. These services are implemented through primary healthcare units and rural health centers, making mental health support more accessible to ordinary Filipinos. BHWs, our nurses, are the frontliners. They conduct home visits, community education, and case follow ups. Family involvement is strongly encouraged because in Philippine culture, family plays a vital role in recovery. Community support networks such as church groups or youth organizations also provide psychosocial strength to those in need. Public health nurses conduct mental health education and promote awareness to help reduce stigma. Simple acts like talking about depression as an illness, not a weakness, make a huge impact. We also provide basic counseling, crisis intervention, and referrals to mental health professionals or appropriate facilities. And we collaborate with local mental health coordinators and multidisciplinary teams, working alongside physicians, psychologists, social workers, and NGOs to ensure comprehensive care. Mental health promotion is also essential in schools and workplaces. In schools, programs integrate life skills education and peer support to help students manage stress and relationships. Guidance counselors and school nurses work together to create safe learning environments. In workplaces, stress management and employee assistance programs help maintain productivity and prevent burnout. We nurses assist in policy implementation and wellness campaigns, like conducting seminars on mental health awareness or facilitating referrals for employees. Partnerships are key to scaling up mental health services. The DOH works closely with LGUs, DepEd, DSWD, DOLE, and NGOs to expand coverage and reach. Faith based and community organizations are strong allies in advocacy and support, especially in rural and culturally conservative areas. PPP or public private partnerships also enhance sustainability through corporate sponsorships, digital tools, or mental health hotlines like the NCMH Crisis Line and DOH helplines. The mental health program faces several challenges. One is a shortage of trained mental health professionals. We have very few psychiatrists and psychologists relative to our population. Funding is limited, and access to medications is still a concern. There's also persistent stigma and misconceptions that prevent people from seeking help. Some still view mental illness as a sign of weakness or a spiritual curse. Lastly, unequal access remains especially in remote and marginalized communities where mental health facilities are scarce. Nurses often bridge that gap. Despite the challenges, the mental health program have many promising developments. The DOH now integrates mental health into universal healthcare through primary care packages that include counseling and psychiatric consultations. We also see the use of telemental health and digital counseling platforms, especially during the pandemic, to reach more people. And there's growing support for community based peer programs and recovery oriented interventions, where individuals with lived experience help others recover and reintegrate. To summarize, mental health is an essential part of holistic community health. Without it, physical health and productivity cannot be sustained. Nurses serve as advocates, educators, and first responders in promoting mental wellness. We are trusted voices who can change how communities perceive and respond to mental health issues. A strengthened and inclusive mental health system where healthcare or mental care is accessible, stigma free, and community based builds resilient Filipino communities that care for both the mind and the body.